Good morning. It's with great excitement that we will be administering the first COVID-19 vaccines to Oregonians today. I'm joined virtually by Director Pat Allen of the Oregon Health Authority and frontline healthcare workers and representatives from hospitals across the state, including Legacy Health and Oregon Health and Science University in Portland, as well as St. Alphonsus in Ontario, Oregon. This is truly the moment we have all been waiting for. This week, 4 Oregon hospital systems received shipments of the Pfizer vaccine, marking the beginning of the next chapter of the pandemic. The delivery of a safe and effective COVID-19 vaccine brings an overwhelming sense of hope and a promise to us all. We kick off this historic vaccine campaign in Oregon with our healthcare workers, who have been our first line of defense against COVID-19. Today, they will receive the first vaccinations. These heroes have poured everything they have into this fight. It hasn't been easy. And to all of our healthcare workers, we say, thank you. Thank you for your courage. Thank you for your commitment to serving your fellow Oregonians over the past several months. Let's celebrate this very bright moment. It has been an incredibly challenging year, but with these vaccines, we can finally begin the long, steady process of turning the tide on the pandemic. You can learn more about Oregon's vaccination plan at covidvaccine.oregon.gov. I know we're all excited to get going. So with that, I'll turn it over to Legacy Hospital to introduce themselves. Brian Terrett, the communications director, is going to take the mic.
Great. Thank you very much. And good morning, Governor Brown. Welcome to Legacy Medical Center. On behalf of the 14,000 employees of Legacy Health and caregivers everywhere, we want to express how proud we are and how honored we are to be part of this historic moment. And we look forward to making sure that we're beyond the COVID pandemic. Now, I'm going to have everybody introduce themselves.
Hi, I'm Myra Gomez. I'm a registered nurse in the ICU at Legacy Manual.
I'm Nathan Olage. I work as a radiographer in the X-ray diagnostic imaging department here at Legacy Medical Center.
I'm Manjula Raghu, and I am the housekeeping supervisor for Randall Children's Hospital and in the tower. Thank you.
Hello, I'm Jamie Carlson. I'm a registered nurse in the emergency department here at Emmanuel Hospital.
My name is Jeremy Howard. I'm a respiratory therapist and I work at Legacy Good Samaritan Hospital.
Your shoulder. Okay, is somebody gonna say 1, 2, 3, go?
3, 2, 1, go.
Let's go. Perfect. High five.
So we're going to ask everybody to stick around for about 15 minutes afterwards. We don't expect anything going on, but if you start to feel a little funky.
You go ahead and just talk.
My name is Myra Gomez. I'm taking this vaccine for my family and also for my community. As a Hispanic nurse, this is disproportionately affecting people of color, and I want to lead by example.
You feel all right? Does that hurt?
Thank you, Ms. Gomez. We really appreciate your leadership and we really appreciate your service to Oregonians. Thanks so much for stepping up today. And with that, I'm going to turn it over to Dr. Renee Edwards. She's the Chief Medical Officer at Oregon Health Sciences University. Dr. Edwards, the floor is yours.
Thank you, Governor Brown. As the governor said, my name is Renee Edwards, and I'm the Chief Medical Officer for OHSU Health. It's truly an honor and a privilege to join you on this historic day. It's just so wonderful to see the first Oregonian healthcare workers at Legacy Health receive this COVID vaccination. With yesterday's shipment of COVID-19 vaccine, we can finally begin to turn the tide against this virus that has been at the center of our daily lives for nearly a year and cost us so many and so much, especially among our most vulnerable populations. With a vaccine that's proven safe and effective, we can finally begin the long journey of recovery from coronavirus and its devastating aftermath. Through the heartbreak and sacrifice of the past 10 months, our frontline healthcare workers have demonstrated incredible resilience and never let us down. On the contrary, they have inspired us with their endless compassion and fierce determination, providing the best possible care amid some of the worst possible challenges. I'm exceedingly proud of our amazing frontline healthcare workers, and I'm thrilled that the vaccines that they, along with all of us, have long awaited have finally arrived. Over the next 3 days, we are pleased to be able to vaccinate 975 healthcare workers at OHSU who are at the highest risk of exposure to COVID-19, starting with one of our intensive care nurses who has repeated and prolonged exposure to patients with known or suspected COVID-19 infection. To care for our sickest patients, our intensive care nurses wear tight-fitting masks, gloves, gowns, face shields, and goggles for up to 12 hours at a time, and sometimes even longer, to protect themselves and their patients from transmitting the virus. This is an arduous and exhausting process, but critical for saving lives. Please think of our ICU nurses when you put on your mask while away from home for just an hour or two. All of us, including all of our vaccinated healthcare workers, will need to continue to wear our protective equipment, our masks, stay 6 feet apart, wash or sanitize our hands, and follow the governor's safety measures until vaccines are widely distributed. The first dose of COVID-19 vaccine at OHSU will be given by Ryan Thrower. Remarkably, she is the first dental resident in the United States, and to our knowledge, the world, to administer a COVID-19 vaccine. Thanks to legislation passed last year, Oregon is the only state in the country that allows dentists and dental students to administer any vaccine to patients of any age. And with that, I'll ask Ansu to introduce himself. Thank you.
My name is Alphonsus Medical Center-Ontario. I am here at ICU. First of all, I am very honored and excited to host healthcare workers to receive this COVID-19 vaccine. If I have been so honest, the last 10 months for me and my colleagues has been exhausting mentally, emotionally, and physically here in the front line in the ICU. As COVID-19 hospitalization cases begin to rise, our ICU beds fill to capacity, our staffing becomes so compressed. It has been absolutely a nightmare and a long journey. We have staffing meetings, pages, your cell phone is full of pages, can you come help? 2 hours, 3 hours, whatever you can offer. It's been a long waited 10 months, almost a year. So with that being said, this vaccination that is coming our way is basically a long overdue and a milestone. We cannot take it for granted. That's why when I was asked to participate, to be among the first people to receive this vaccine, I said, I don't want to give a second to it. I'm going to do it. So given that the vaccine is available, it does not mean that we are out of the woods yet. We have to continue to exercise our long distancing, wear masks until the vaccine is available to all Oregonians. And if indeed it's available to all Oregonians, the challenge becomes who are going to be taking it, because there are a lot of misconceptions out there, even among my own colleagues, who are saying, I'm not going to take it. So as healthcare workers, we have to be the role model for the public, for our patient, for our family, because if you are an RN, you are the bedside, you are ready to administer, you offer the medication, the vaccine to your patient, the first thing they will ask you is, have you taken it yourself? Your answer better be, yes, I have. Because if you said no, you have a lot of education to offer. So really, my advice is, as healthcare workers, our profession is purely scientific. So we gotta be ready to educate the public. And to my fellow Black and Latino, the colored people, the number one reason why I came here to volunteer to do this is basically our community. In particular, coronavirus have not identified, it does not discriminate against political party, it does not discriminate against anything we can say, but I can say that it discriminates against race, because it's killing more Black and more Latino than any other race, ethnic group in this country here. So that being said, we are known, Black American or Black or Latino, we are known to be absolutely non-compliant when it comes to things like this. So we gotta be ready as healthcare workers to educate ourselves, to educate our family, to educate the public in particular, to just take the vaccine when it's available, when it becomes available to all of us. With that, I'm gonna turn back to the governor, and thank you so much for the sacrifice. And then let's continue to do what we do best to keep our public safe, our family safe, and healthy.
Okay.
So with that,
Can I get a release, please?
yeah.
Thank you, Ansu. For those of us just joining, Ansu is an intensive care nurse at Oregon Health Sciences University. We appreciate the service you have given to Oregonians over the last year. I know it's been a grueling and challenging year. Thank you for your compassion and thank you for your courage. Also, congratulations to Ryan on being the first in your category in the United States and maybe in the world to be administering a vaccine. Dr. Edwards, thank you for your leadership. And with that, we're going to the other side of Oregon, Ontario, Oregon, where St. Alphonsus is located. St. Alphonsus has been, frankly, on the front lines of this pandemic. both in terms of meeting the needs of folks in Eastern Oregon, but also in Idaho as well. And I'm going to be turning it over to Dina Ellwanger. She is the President and Chief Nursing Officer. Take it away.
Thank you. And thank you for this opportunity to be able to share what an honor it has been to be selected as one of the few facilities to receive this vaccination in this state. We're pleased to be able to protect healthcare workers in the rural Eastern Oregon. These vaccinations mean that we'll be able to stay on the job and care for our community, which they so deserve. At this time, the COVID-19 vaccine will not be mandated for St. Alphonsus colleagues as an employment requirement. It is voluntary and being offered first to colleagues providing frontline care. But as president, as well as a registered nurse, I support this vaccination and am excited to be able to receive now that I am a frontline supporter. I have committed this week and many weeks to come to staff the Ontario Vaccination Clinic. This will allow the other registered nurses to stay on the floor and provide the care that our patients deserve where their expert is needed. I'm going to introduce Hallie Scott. She's one of our intensive care registered nurses who's going to vaccinate me so I can go staff the vaccination clinic. These vaccinations are particularly important for this community as our spread has been very high. We, Boyle, Idaho, where safety measures have not been as strict. There is a big influx of Idaho people coming into the city of Ontario, as Ontario is the center of commerce along the border for employment. We received the Pfizer vaccine yesterday, but because of extensive planning of these last couple of weeks, we were able to pull a clinic together today. In the last 2 hours, we have vaccinated over 20 frontline caregivers, including providers, nurses, respiratory therapists, radiology techs, and lab. We also are working closely with the county entities to provide vaccinations to the county healthcare workers while ensuring to follow state guidelines on vaccine distribution and prioritization. I am fully confident in the COVID-19 vaccine safety and efficiency as approved by the FDA, and I am encouraging friends and families to receive it. I actually feel quite blessed, as many of my family members are in the healthcare setting and our frontline caregivers, knowing that they too will be offered this vaccination in the very near future. While the delivery of the vaccine is indeed good news, it will take some time for everyone to have this. So until people get vaccinated, it's critically important that everyone continues to precaution of the spreading of this virus. That includes wearing of the mask, maintaining physical social distancing, avoiding large crowds, and frequently washing the hands and surfaces. It is crucial that we all remain and continue upholding our personal safe living and decision-making responsibilities, even after we are vaccinated, as it will likely be mid-2021 before the vaccine is more broadly available. We seek to keep our community well informed, and that is why we've created a special vaccine section on our website. Please log on to stalphonsus.org for an update on information and facts regarding the vaccination. Thank you for giving me this opportunity to share feedback from the Eastern Oregon State and St. Alphonsus, Ontario, and the option to share with you. Thank you, Governor Brown, and I turn it back over to you.
Thank you so much, Dina, and thank you so much to you and your team for doing an extraordinary job serving the healthcare needs of folks living in Eastern Oregon and in our rural communities. So keep up the good work. We're going to go back to Oregon Health Sciences University to actually get the shot of Ansu, our intensive care nurse, getting vaccinated by Ryan. So back to OHSU. Thank you, Ansu. Thank you, Ryan. We really appreciate your heroic efforts to keep Oregonians safe. And with that, I'm going to turn it over to Director Pat Allen. He's Director of the Oregon Health Authority. Director Allen, the floor is yours.
Thank you, Governor Brown. And thank you to the healthcare workers who received their vaccinations today. I'm grateful for the care you've provided to patients with the most severe cases of COVID-19 and other Oregonians hospitalized with serious illnesses. I'm also grateful to all the teams at St. Alphonsus, Legacy Health, Kaiser, and OHSU who have organized vaccination programs at your hospitals. I'm grateful to all the other Oregon hospitals who are gearing up to administer vaccinations later this week. I appreciate your careful planning and your efforts to ensure life-saving vaccines are administered with maximum speed and efficiency and a minimum of disruption to staffing and patient care. Before I tell you about what comes next in Oregon's intensive vaccination effort, I want to step back and mark what this historic moment means in our lives. On February 28th, 2020, 292 days ago, the world changed for all of us. That was the day the first COVID-19 case was diagnosed in Oregon. Since that day, we've had 96,092 cases of COVID-19 in Oregon. 1,160 deaths have occurred. Right now, more than 500 people are hospitalized across the state with severe COVID-19 illness. In Oregon, we have the fourth lowest COVID-19 case rate in the United States and one of the lowest death rates. If Oregon suffered the same state death rate as the US median, more than 3,500 Oregonians would have lost their lives. We've had relatively better success containing COVID-19 in Oregon because Governor Brown took early and decisive action to order proven science-based social distancing measures that slowed the spread of COVID-19 in our state and protected Oregonians while the virus raged across the nation. Oregonians, displaying our typical spirit of resilience and responsibility, have been wearing masks, cutting back on get-togethers, and adapting to the other changes in our lives that social distancing requires. Healthcare providers, like the brave and dedicated healthcare workers here today, and public health workers across the state have worked tirelessly to provide care and comfort to the sick and protect people at risk. Today, the world has changed again. Today, we've seen the first COVID-19 vaccinations in Oregon. I want every Oregonian to know, COVID-19 vaccination is the safest, most effective, most reliable way to keep yourself and your family and your community healthy and safe from the coronavirus. The vaccine is safe. The COVID-19 vaccine administered today has been tested in one of the largest and most rigorous clinical trials of any vaccine ever developed. Among more than 40,000 people from all backgrounds and all walks of life who participated, this vaccine was found to have no serious safety concerns. The vaccine is effective. The COVID-19 vaccine administered today is 95% effective. That's an extraordinary rate of efficacy in a vaccine, which offers Oregonians a high degree of protection. I want to be totally transparent. In the large trials, about 1 in 3 people experienced fever or chills, while others reported headaches, muscle aches, or fatigue. That's why hospitals are being so careful in their planning. But those effects show the vaccine is stimulating the body's natural immune response. It means it's working. They're not signs of illness. Now let me tell you what the Oregon Health Authority is doing to roll out the COVID-19 vaccines as quickly and safely as possible. Right now, the United States does not have enough vaccine to immunize everyone. Because we've received limited doses of vaccines from the federal government, we have to prioritize who gets the vaccine first. Oregon will prioritize people who are most at risk and hardest hit. So as in other states, there will be 3 phases to our rollout. Phase 1 is divided into 3 subphases. In phase 1A, we'll start with healthcare workers and residents and staff in nursing homes and other long-term care facilities. Phase 1B will include workers in essential and critical industries. And phase 1C will vaccinate people at high risk for severe COVID illness due to underlying medical conditions, people 65 years and older. In phase 2, we'll vaccinate other critical populations, and then we'll move to the general population in phase 3. Let me give you some more details about phase 1A. It'll include frontline healthcare workers like the staff you've seen today. They will receive the first vaccinations. When we say healthcare workers, we don't just mean frontline medical personnel. We mean anyone in a healthcare setting who comes into contact with patients and could be exposed to the virus. Oregon's definition of healthcare workers includes, but isn't limited to, emergency medical service personnel, nurses, nursing assistants, home healthcare personnel, physicians, technicians, therapists, phlebotomists, pharmacists, students, and trainees. But it also means staff in clerical, dietary, laundry, nutrition, and other non-direct patient care services. The Oregon Health Authority has proposed vaccinating Oregon's 300,000 to 400,000 healthcare workers and residents in long-term care in a sequence of 4 groups, working through each group in consecutive order. Group 1 will include hospitals, urgent care settings, skilled nursing and memory care facility personnel and residents, tribal health programs, emergency medical service providers, and other first responders, among others. Group 2 will include other long-term care facility and congregate care sites, including residential behavioral health programs, hospice programs, mobile crisis care, and more. Group 3 will include outpatient settings serving specific high-risk groups, home healthcare providers, day treatment services, non-emergency medical transportation. Group 4 will be all other outpatient public health and early learning sites and those who care for those who have passed. How quickly can we get through these groups? Oregon has received 35,100 doses of the Pfizer vaccine. On December 22nd, we expect to receive another 40,950 doses, with another 48,750 expected to arrive on December 29th. In addition, we expect the Moderna vaccine to be granted emergency use authorization from the federal government this week. If that happens, we expect to receive 71,900 doses on December 22nd and 31,700 doses on December 29th. Beyond the 4 hospital systems that received the initial shipments, vaccine doses will be distributed to hospitals across the state. By the end of this month, we will have received enough vaccine for about 100,000 Oregonians to receive a first and second dose. Next week, vaccinations will begin in long-term care facilities. We do not have more information from our federal partners about additional shipments, and so it's impossible for us to project how quickly they'll arrive beginning in January. Here's a value I want to emphasize. Health equity is at the core of our vaccination plan. As we move forward, we're convening a vaccine advisory committee to guide our decisions about prioritizing essential workers and other populations in phases 1, 2, and 3. We know community trust and buy-in are vital to achieving the critical mass of immunizations Oregon needs to stop the spread of COVID-19 in our state. At OHA, we're committed to listening to the community as we work to reach community immunity, stop new infections, and prevent more hospitalizations and deaths. The virus has taken so much from us. We all want to restore the normal ways we work, play, and connect with each other. The world will change again when Oregon achieves community immunity. That means all of us need to do our part and get vaccinated like these healthcare workers did today. While the safe and effective vaccines are the light at the end of this long, dark, nightmarish pandemic tunnel, we're not out yet. We all need to keep up our guard, keep wearing masks, keep limiting your social get-togethers, avoid large groups, stay home when you're sick, and keep washing your hands. Thank you for all you've done to slow the spread of COVID-19 and save lives. We need to keep it up until we achieve community immunity. Now let me turn it back over to Governor Brown.
Thank you, Director Allen, and thank you for your stalwart leadership throughout this pandemic. With that, Charles, I think we're ready to take questions. We have a few moments for questions.
Thank you, Governor. Just a reminder to the reporters on the phone, please use the raise your hand function under the participants tab to get in line to ask a question. For our first question, we have Carmen Montez from Univision. Go ahead, Carmen.
Good morning. I hope you're able to hear me. My question is, what's the timeline to vaccinate those restaurant workers, farm workers, or grocery workers that are also frontline personnel in these phases?
Thank you. Our goal obviously is to get Oregonians across the state immunized as quickly as possible so we achieve community immunity. At this point in time, we have received no further instructions from the federal government and no further notice about what additional vaccines we're going to receive. As Director Allen said, we've received roughly 147,000 that we are expecting through the end of the year. That's enough to vaccinate roughly 100,000 of our priority healthcare workers. Director Allen.
Thanks, Governor. Just quickly, the numbers get a little confusing in terms of first shipments and second shipments. We'll receive about 200,000 doses during the month of December, which is enough to provide 2 doses to 100,000 Oregonians. I mentioned that pool of frontline healthcare workers, long-term care residents, and employees is somewhere between 300,000 and 400,000 Oregonians. So we will not get through that 1A category until January at the very earliest, and potentially later. But as we've said a couple of times, we've been given no indication of exactly how much vaccine to expect to receive on a regular basis after the end of this month. And so we're just not going to try to make a prediction until we've got something hard to base that prediction on.
Thank you, Carmen. We'll go next to Gary Warner with EO Media. Go ahead, Gary.
Hi, Governor. There's been a lot of conversation about that the worst is still yet to come. Can you quantify that somewhat? IHME, which we've used in the past up in Washington, is projecting on current path about 500,000 deaths in the United States by April 1st and 5,000 in Oregon.
Thank you, Gary. Certainly hope is here in terms of the vaccinations that we were able to do today. But as you heard from the conversation, that's still a very small portion of Oregonians that we will be able to vaccinate during December. As you know, our numbers have plateaued over the last couple of days because Oregonians have made tremendous sacrifices in reducing their social gatherings, in complying with safety protocol, all of which is extremely difficult, and particularly during the holiday season, really, really challenging. So until vaccines are widely available, we need, and I should say, and people are actually vaccinated and we've achieved community immunity, we need every single Oregonian to keep up the measures to not only protect themselves and their family members, but their vulnerable community members that are struggling with cancer or other medical conditions. We need folks to continue wearing their face coverings, their masks. We need people to continue to watch their distance and avoid large social gatherings. And of course, to wash your hands. We're asking Oregonians to continue to stay home when you're sick and get a flu shot if you can. So we're going to move as quickly as possible, assuming we continue to receive these vaccines from the federal government. Oregon has a very effective and robust vaccine distribution program that we are going to build on, working with our community partners and our community-based organizations. But in the meantime, we need every single Oregonian to step up and continue with safety protocol.
Thank you, Gary. We'll go next to Genevieve Rium with K2. Go ahead, Genevieve.
Hi, Governor Brown. Thanks for taking this question. Well, today is certainly a momentous day in Oregon's history. We've just witnessed those healthcare workers getting vaccinations. I just confirmed this morning that Oregon is the 49th state to start vaccinating its frontline healthcare workers. Why this delay? Why are we in nearly last place?
Great question. I'm going to turn it over to Director Allen.
Thanks, Governor. The vaccine was distributed directly to hospitals, which each needed to make their own logistical plans around how to manage the distribution of the vaccine, how to account for potential side effects, and all these kinds of things. And so the fact that it happened within 24 to 48 hours, which is what was the common timing all across the country, really has no impact on how quickly we'll be able to vaccinate Oregonians. This is going to roll out rapidly throughout our healthcare system and then beyond as we receive further supplies.
And is Legacy still on the line? Are we able to ask them some questions?
Sure. Let's turn it over to Brian at Legacy, please. Can you pick up the mic?
Can you hear me on the mic?
Yeah, we
Great.
got you, Brian. Thanks for taking this question. We know that Legacy was the first hospital system in the state to get the vaccines. You got them on Monday and you just started vaccinating on Wednesday. We've seen other states across the country start vaccinating within just hours of getting their vaccine. Can you explain why there was the delay at Legacy?
Absolutely. I have our Director of Employee Health here as well, who can also answer the question. But it's important to make sure that all of our systems were in place, that we fully understood the vaccine. We had to make sure that we went through the detailed documentation that came with it, because we wanted to make sure we did it right. We don't want to get this one wrong. In addition to that, everybody who's getting the vaccine today is about to go off on their days off. If they have side effects, they will occur on their days off, and it won't impact our ability to staff beds. I hope that makes sense.
No, that certainly makes sense. And just a quick follow-up to that. I mean, we've seen states turn around the vaccine in just hours. So was Oregon not prepared to administer these as quickly as other states?
The challenge here is I don't know the details about the other states. I don't know if they've received their vaccine earlier or when they received their vaccine. What I can tell you is that we felt like it was important to do it the right way and do it the safe way. And we felt like, within 48 hours of receiving the vaccine certainly means that we're getting the vaccines out.
Okay, thank you. Governor Brown, if you have time for one quick question from a colleague of mine, she's asking, what's the state's long-term strategy to get 3 million people vaccinated next year? I know you don't have information from the federal government, but is there a plan in place right now to get to that 3 million mark?
Absolutely. Our plan is on our website. I mentioned the address earlier in my remarks. Our goal is to frankly leverage the robust and effective vaccine distribution system that we already have in place to work quickly toward community immunity. What I have to be very clear with Oregonians about is that we want to make sure that our most vulnerable and most in need populations get the vaccine first. So as Director Allen mentioned, we are prioritizing healthcare workers and others in 1A. It's a very broad description of healthcare workers because equity is at the forefront of our work here. For example, you saw from Legacy a number of folks getting vaccinated, all who are a part of our healthcare response. We obviously will go next to our essential workers, and that's where community voices come in. We will be convening a vaccine advisory committee to help make the decisions about which essential workers go first, and then we will continue from there. We obviously need to protect our most vulnerable Oregonians. Director Allen, would you like to add anything?
I would, thank you. So the plan basically is that the vaccine will start being distributed primarily in hospital health systems, as we're in this very narrow phase where we don't have a lot of vaccine available. As we move into the later stages of phase 1 and into phase 2, that distribution channel will widen out to federally qualified health centers and other providers that are already part of our vaccine distribution system. By the time we get to phase 3, there should be enough COVID vaccine available that it becomes something that you obtain like you obtain any other vaccine. The federal government will have partnerships with retail pharmacies. It'll be in regular healthcare providers' offices, those kinds of things. As the governor said, that's already a robust system in Oregon. And if you'd like to test it out and haven't gotten your flu shot yet, it's not too late to go and get a flu shot at your local pharmacy or your healthcare provider. And that's a good idea to do right now.
Thanks, Genevieve. We've got a lot of your colleagues in the queue, and I'm told that we have Myra Gomez back at Legacy Health. So we're going to go back to her. I know we had some sound issues earlier when she spoke after getting one of the first shots. So we'll go now back to Legacy Health.
I'm getting this vaccine to be an example for my community. COVID is disproportionately affecting persons of color, and I would love to lead by example. COVID está afectando la comunidad hispana más que nada, y quiero ser un ejemplo para mi comunidad.
Thank you so much, Myra.
So much, Myra. Thank you for your leadership. Thank you for your compassion for your fellow Oregonians.
You're welcome.
We'll go back to questions for just a few more minutes. We'll go next to Les Zeitz with the Malheur Enterprise. Go ahead, Les.
Yeah, this is probably for Pat Allen. Pat, this was a sort of a test run of the logistics of moving the vaccines around. What lessons did you and your staff in the hospitals learn in this first phase, if anything?
Yeah, thanks, Les. Good question. This first shipment was sort of a pre-positioning shipment that was pretty small. And so there really weren't any particular logistical hurdles around it. It was a single shipment received at 5 sites, 2 at Legacy and the 3 at the other systems. I think we'll have the opportunity to learn lessons as that volume ramps up, as we receive larger shipments and as those shipments are then broken down and further distributed out to more hospital systems, but that part hasn't happened yet.
Well, if I may ask, Pat, where do you expect possible pinch points in the system?
Yeah, I think the Pfizer vaccine provides the biggest challenges in terms of this ultra cold storage chain, and in particular, what happens is as we move them out of ultra cold storage to other settings in other hospitals, there's a time limit on how long you can do that and how long you can maintain the cold chain. It's about 5 days, I believe. And there's a certain sort of minimum size shipment you can send to someone receiving it. And you need to know that they can get through that many doses in that period of time. As we move to bigger hospital systems around the Portland area or other metropolitan areas, I don't think that's a problem. As we move to more rural communities, I think that becomes a significant issue. And that's why the Moderna vaccine is so important. And it's so important that it's equally as effective as the Pfizer vaccine. I think that won't have the constraints on the need to rapidly use a large number of doses. And so one of our challenges will be balancing that distribution to what the demand is, where the capacity is to provide the vaccines, and how rapidly they can be used.
Okay, thank you.
Mm-hmm.
Thanks, Les. We'll go next to Pat Duras with KGW. Go ahead, Pat.
Good morning. Thank you. This is more for Pat Allen, although Governor, we always appreciate your comments. But Pat, I'm wondering if you could clarify. I think I heard you say that we're going to get about 200,000 doses into Oregon by the end of the month, which will cover about 100,000 Oregonians. So are you telling the hospitals they should hold back half of what they get? Because I think the federal guidance is to use everything. So that would be 200,000 Oregonians getting vaccinated by the end of December.
Yeah, so this is where the numbers get complicated. The federal government said that about the initial shipments, but the shipments that arrive on the 29th of December are intended to be second dose shipments. And so rather than, there's a complicated chart that we have that kind of tries to spell all that out. But by the time you account for first doses and second doses and shipments that are intended to be second doses, it's much easier to just think of it in terms of 2 doses for about 100,000 Oregonians at that point.
Okay, thanks for clarifying.
Mm-hmm.
Thanks, Pat.
Thanks, Pat. We'll go next to Amelia Templeton with OPB. Go ahead, Amelia.
Thank you. I'm unmuted. You may hear my kiddo in the background, sorry. So I'm confused. How many doses of the vaccine has Oregon actually received at this point in time? And where are they?
Thank you, Amelia. I'm going to turn that one over to Director Allen.
Thanks, Governor. We've received about 5,800 doses, and those doses are at 2 Legacy facilities, a Kaiser facility, OHSU, and St. Alphonsus.
That's far less than other states. Why have we received so many fewer?
The distributions are based on adult population, and that's the pre-positioning amount. The larger amount will follow next week on the second shipments from Pfizer and ideally a first shipment from Moderna.
Why did we decide to go with this pre-positioning strategy? I mean, we heard from Peace Health Vancouver, for example, that's one hospital in Southwest Washington that they have 4,000 doses already. So why did we opt to just get this limited number here in Oregon?
We didn't opt to get a limited number. This is the amount that we were able to get in the federal system, and we distributed it to the 5 hospitals that have ultra cold storage capabilities.
Okay, so just to be clear, you expect to have by the end of this week 5,800 doses total and then more coming next week?
We have 5,800 doses in hand right now and expect to get more next week and the week after.
Thanks, Amelia. We have time for just one more question before we go back to Legacy Health. So we'll go now to Brenna Kelly with KPTV. Go ahead, Brenna.
Good afternoon, and thanks for taking my question. I wanted to know about the pharmacy situation. We hear that Fred Meyer is going to be one location that will be distributing to the public after we get through these priority healthcare workers and essential workers. So separate from the federal partnership with the 3 pharmacies we heard about in a Thursday OHA webinar, can you talk about any additional pharmacies at popular places like Fred Meyer that will eventually be open to the public for vaccinations?
Director Allen, do you want to take that one?
Happy to. So the federal pharmacy partnership has got a couple of different phases to it. The initial phase is through Walgreens and others, and it's aimed at delivering vaccine to long-term care facilities to do on-site vaccinations of residents and workers. They are separately pursuing relationships with retail pharmacies, Safeway, Fred Meyer, those kinds of things. As you say, in later phases, and again, just like other vaccines, flu, shingles, those kinds of things, to make those available in those retail locations when the vaccine is widely available and in plentiful supply.
And so that will also be a federal partnership then?
Correct.
Thank you.
Thanks, Brenna. We're now going to go back to Legacy Health, where I believe Jeremy Howard is on hand.
Hello, I just got the vaccine, complete with a Bugs Bunny Looney Tunes Band-Aid, and I feel fantastic, no ill effects at all. So it was easy, just like the flu vaccine.
Thank you, Jeremy. We'll go back now to Governor Brown.
Thank you, Charles. Do we have any of the other hospitals that are willing to give us an update? Oregon Health Sciences University or St. Alphonsus?
Hi, Governor Brown. This is Dina Elwinger again. So my arm is feeling very well. I didn't get the Looney Tunes Band-Aid, but I got a good Band-Aid and I feel totally fine right now. Thank you.
Thank you so much. And any update from OHSU? Okay. Well, with that, I want to say thank you to all of our healthcare workers for your compassion, your commitment, and your courage in working to meet the health needs of Oregonians across the state. We are incredibly grateful for your dedication and determination and for your service. We are looking forward to getting you all vaccinated as quickly as possible. And in the meantime, remember that vaccines don't save lives, vaccinations do. And I again want to ask Oregonians across the state to continue to comply with safety protocol to protect yourself, to protect your family members and loved ones, and to protect your vulnerable community members. With that, thank you all so much. Have a great day.